Hello, everyone. Welcome to Inconvenient Truths. I'm your host, Jennifer Zheng. Recently, there have been frequent reports of recurring COVID outbreaks and overcrowded hospitals throughout China. However, I've been preoccupied with other topics and haven't addressed this matter. On June 11th, after 42 days of silence, the Chinese Center for Disease Control and Prevention (CDC) suddenly released astonishing data revealing that the epidemic in China has not only persisted but is experiencing a significant resurgence. The actions of the CCP's top leadership also serve as evidence of this. Today, let's discuss this critical issue. On June 11th, the Chinese CDC announced that from May 22nd to 28th, 42.5% of patients with flu-like symptoms tested positive for COVID-19. This percentage is similar to the data reported in mid-December 2022. This chart represents the COVID positive rate in influenza-like cases released by the Chinese CDC. It shows that from December 12th to 18th, 2022, the COVID positive rate was 33.2%. From December 19th to 25th, it reached 59.5%, with the highest point being 60%. After dropping to a low of 2.7% in March, it rose to 42.5% in May. The period from December 2022 to January 2023 marked the peak of infections after the COVID-19 lockdowns were lifted across China. Currently, the infection rate is approaching the late December 2022 peak, indicating a severe situation. However, the CDC's latest report concludes with the following statement, quote, "Comprehensive monitoring data shows that from February to early April this year, sporadic outbreaks of COVID infections occurred nationwide. Starting from late April, the upward trend slowed down, and currently it is showing a downward trend," unquote. This conclusion completely contradicts the curve they provided, which is truly laughable. It is evident that the Chinese CDC is following the CCP's instructions and demonstrating a high level of political consciousness. Furthermore, the chart indicates a low positive rate for COVID-19 in March and April, while the positive rate for flu was high. This raises serious doubts that the Chinese CDC has been counting COVID-19 cases as flu cases to align with the official propaganda of a victory in defeating the pandemic. The CDC's report also mentions that on May 5th, the World Health Organization announced that COVID-19 no longer constitutes a public health emergency for international concern. In China, COVID-19 is classified as a Class B infectious disease under Class 2 management. According to the requirements for the public release of information on legally designated infectious disease epidemics, it should be published monthly. The CCP abandoned its zero COVID policy in early December 2022 and downgraded COVID-19 to a Class B infectious disease under Class 2 management. However, the Chinese CDC continued issuing weekly epidemic reports from early January until April 29th. Throughout May, the epidemic clearly worsened, but the Chinese CDC remained silent for 42 days before reporting the situation again. Why did they remain silent? It is because the epidemic research in China after the WHO's announcement that COVID is no longer a global emergency. This is embarrassing for the CCP, so the Chinese CDC had to remain silent, especially since the CCP's Politburo claimed at a meeting on April 28th that they had achieved a decisive victory in pandemic prevention and control. Now, perhaps it's too difficult to conceal the serious outbreaks, and the Chinese CCP had no choice but to report the situation again and suddenly announce new numbers of infected and death cases. According to the Chinese CDC report, there were a total of 2,777 new severe cases and 164 deaths from May 1st to May 31st. On February 25th, the Chinese CDC reported no deaths among COVID-19 infected patients in hospitals as of February 23rd. From late February to the end of April, the Chinese CDC did not announce any deaths due to COVID. They remained silent in May but suddenly announced 164 deaths for the month on June 11th. The Chinese CDC had previously announced 6 deaths among COVID-19 infected patients in hospitals on February 16th. On the same day, the CCP Politburo Standing Committee held a meeting and officially declared a decisive victory in pandemic prevention and control, claiming to have created an unprecedented miracle in human history. Subsequently, on February 23rd, the CDC announced that there were no deaths due to COVID. The latest report from the Chinese CDC disclosed 2,777 new severe cases in May, but did not disclose the total number of COVID-infected patients in hospitals. According to commentator Zhong Yuan from the Epoch Times, it is estimated that there are currently tens of thousands or even hundreds of thousands of COVID-19 infected patients in hospitals in China. The Chinese CDC did not dare to disclose this information, clearly intending to cover up the truth of the rapid increase in the epidemic. At the same time, they are eager to argue that the number of fever clinic visits, severe cases, and deaths in May has increased but remains low overall, much lower than during the peak of the epidemic at the end of last year. However, while the CDC is trying to downplay the seriousness of the situation, the CCP's mouthpiece Xinhua News Agency unintentionally leaked some truths on May 28th. It reported the number of reinfection cases has increased. How should we view the current situation? How to respond scientifically? They quoted Li Zhongzhen, the director of the infectious disease department at Beijing Yuan Hospital, who said the number of visits to fever clinics had indeed increased recently. Patients' symptoms are mainly focused on fever and respiratory symptoms, including sore throat, cough, nasal congestion, runny nose, headache, muscle pain, etc. Individual patients may also experience symptoms such as vomiting and diarrhea. It can be seen that the symptoms of the reinfected patients are still similar to those of initial infections. By the end of May, the proportion of reinfected patients seeking medical treatment in hospitals had reached 42.5%. But the CCP continued to lie, claiming that the epidemic was currently trending downward. While the Chinese CDC is concealing the truth, it is evident that the CCP high-level officials are aware of the severity of the epidemic. They publicly declare victory in epidemic prevention without revealing the truth to the public and to the international community, but they strictly take precautions themselves. For example, during Xi Jinping's visit to Xiong'an area and Hebei province from May 10th to 12th, he not only wore a mask but also sunglasses, even when outdoors. The high-ranking officials of the Politburo accompanying him also wore masks. In this picture, everyone can be seen wearing masks indoors. On May 18th and 19th, when Xi Jinping receiving the heads of state from 5 Central Asian countries in Xi'an City, only Xi Jinping and the heads of state were not required to wear masks, while all the surrounding staff were required to wear masks. The same applies to the welcoming banquet. On May 18th, during Xi Jinping's meeting with the president of Tajikistan in Xi'an, the people around them were wearing masks. And on May 24th, when Russian Prime Minister Mishustin visited China and met with Xi Jinping and Chinese Premier Li Qiang, the people around them were also required to wear masks. And on May 29th, during the collective study session of the CCP Politburo, everyone except Xi Jinping wore masks. 3 members of the Politburo, including Zhang Youxia, vice chairman of the Central Military Commission, were not present, and it is difficult to confirm whether they were infected. However, during the presentation by Qiu Yong, the party secretary of Tsinghua University and a member of the Chinese Academy of Sciences, he even wore a mask while speaking. According to Xinhua News Agency, the Politburo meeting discussed the severe internal and external situation, which likely included the epidemic, but Xinhua did not dare to publicly disclose the details. From June 6th and to 8th, Xi Jinping conducted an inspection in Inner Mongolia, where strict epidemic prevention measures were still implemented. On June 7th, during Xi Jinping's briefing with the military, he was the only one not wearing a mask, and the other people kept a considerable distance from him. Vice Chairman of the Central Military Commission, Zhang Youxia, was absent once again, and this is very unusual. This screenshot from a TV report shows that Xi Jinping also wore a mask when entering the venue. These several screenshots from TV reports show that the military officers attending the meeting were all wearing masks. Such scenes where everyone wears masks may no longer be seen in other countries. On June 12th, Xi Jinping held a welcoming ceremony in Beijing for the visiting president of Honduras, and the staff from both sides were still wearing masks outdoors. Therefore, based on the behavior of the CCP high-level officials and the sudden announcement of a positive COVID rate as high as 42.5%, it is possible that the epidemic in China has once again spiraled out of control. As for the extent of the loss of control and the number of deaths, it is likely another state secret that the outside world cannot know. Well, that concludes today's segment. Thank you very much for watching. Please subscribe to my channel if you haven't already, and make sure you are still subscribed if you are. If you enjoy my content, please help spread the word about my channel and videos. You can also visit my website at jenniferzeng.com, jenniferzengblog.com. That's jenniferzengblog.com. Sign up for a membership or make a donation to support my efforts. Thank you and see you soon.